Today we'll talk about a 60-year-old Asian man who presented to his gastroenterologist complaining of abdominal pain in the right upper quadrant. History of diabetes, hypertension, which is controlled with ramipril. Of note, he has chronic hepatitis C, which is diagnosed almost 9 years ago, was treated initially with interferon, and thankfully his performance status is still good, ECOG 0. An MRI of the abdomen took place, and it showed a single 7-centimeter lesion in the right hepatic lobe. And the biopsy confirmed the presence of hepatocellular carcinoma. Of note, surgery was not recommended, was not the appropriate therapy because the tumor was deemed unresectable, mainly because of closeness to vascular invasion. And as such, the patients with locally advanced disease went ahead and received chemoembolization 3 times and with excellent response. However, 6 months later, a CT scan showed that the liver tumors are worse. If anything, new liver lesions, abdominal wall extensive metastases, and lung metastases. Liver function was remained still good, Charles-Pugh score A, and if anything, the alpha-fetoprotein start elevating itself a little bit, 752, while at baseline, if it was close to about 250. So the patient with the presence of metastatic HCC, BCLC-C, or stage 4 disease went ahead and was started on lenvatinib 12 milligram daily. And after 8 weeks, there was clear evidence of partial response. And maybe about 9 months into the treatment, patient started developing grade 3 hypertension. A calcium channel blocker was added, and the lenvatinib was held until the hypertension increase of the blood pressure improved, and patient was restarted on the lenvatinib with a lower dose of 8 milligram daily. And the patient continued on the reduced dose and really stayed on the therapy for another 6 months until progression of disease is noted. So one might wonder, what do we learn from that study and what's so special about this case per se? I would like to start by talking about the why did this patient get HCC to begin with? As we know, hepatitis C is what we always call the silent epidemic. Thankfully, nowadays, there's a lot of therapies that can really treat the hepatitis C and actually cure from the hepatitis C. But as we noticed, the patient received interferon, which is not a curative intent. And if anything, patients might develop hepatocellular carcinoma if they have a chronic hepatitis, which is not cured per se. And it's very important, if a patient is aware of the presence of hepatitis C, is to really seek medical attention and care, attempt hopefully at treating the hepatitis C, and more importantly, if they have a chronic hepatitis C, make sure that they continue with their regular screening to ensure that if there was any liver cancer, to catch it rather earlier than later. Understandably, we like to catch the disease in the early phases because curative intent, like for example surgery, transplant, RFA might be applicable. Well, of course, like in the situation of our patient today, sadly, the extent of disease limit us from providing or offering any curative therapy.